So, Amy, thank you so much for joining us today.
Thank you for having me.
I'd love to talk to you about the study that you and your colleagues have done about the working conditions of nurses. Now, what's interesting to me in reading your paper is that the U.S. Labor history has had such a long tradition of trade unions fighting for the 8-hour workday. But in your study, you found that nurses actually are not part of that. Many of them work 12 or 13 hours, 13-hour shifts. Mm-hmm. Why does this situation exist, and how has it come about?
So nurses traditionally worked 8-hour days. And then in the 1980s and 1990s, when there were some structural changes in healthcare and there was cost containment measures put in, it was actually less expensive to have nurses work 12-hour shifts because that was only 2 nurses per day instead of 3. And so nurses began working these 12-hour shifts, and in fact, they just decided that they really liked it because it offered better work-life balance, so nurses could work 3 days instead of 5, so they had more time off for their family and friends. It meant fewer commutes, and they had more time to go back to school. So it's really become very prevalent. Most hospitals either offer 12-hour shifts and 8-hour shifts, and some hospitals only offer 12-hour shifts, so it's very, very common now.
So do nurses have a choice? They can choose whether to, is it voluntary or is it?
It depends on the hospital, and sometimes it depends on the unit in which they work. So some hospitals may give the option when a nurse is hired if they're going to be hired into a unit that only schedules 12-hour shifts, or it may do a mix of 12 hours and 8 hours.
So from your research, from your paper, it seems like nurses don't have work-hour policies. There are no work-hour policies for nurses. Are there other professions where such policies exist, and why is there a difference?
There are. So other safety-sensitive industries like physicians, pilots, long-distance truck drivers, they all have work-hour restrictions, and there aren't any national work-hour restrictions for nurses. And in certain states, there are mandatory overtime prohibition, but nurses can work as much voluntary overtime as they want. And when this issue was looked into, and for example, in the state of Texas a few years ago, the State Board of Nursing was considering doing some work-hour restrictions. And when they put it to a vote, over 90% of the nurses said that they do not want any restrictions on their work hours. So it's a very complex situation.
It certainly seems like it because, looking at your study, you looked at the impact of long shifts on things like burnout and job satisfaction and other factors among nurses. What were some of your major findings?
So our main findings, we found that when nurses worked above the standard 8-hour shift, that they were at increased odds of being burned out and dissatisfied and also intending to leave their employer in the next year. And this was worse for the nurses that worked the longest shift. So if they worked over 13 hours, they had a 2-fold increase in the odds of being burned out and dissatisfied and intending to leave their employer. So their overall well-being was definitely being impacted by these long shifts.
And yours was not a national study. You covered 4 states, right?
Correct.
So in which states was the condition the worst?
It was very similar, actually, across the states. So we found that this wasn't a phenomenon found only in California, but maybe not in New Jersey. It was found in all the states where nurses were working these extended shifts.
When the nurses are overworked, of course, as you pointed out, they get more frustrated and the chances of burnout are much higher. But does it also have an impact on patient outcomes?
Yes, so this was actually the first study to look at the relationship between nurses' shift length and how patients perceive their care in the hospitals. And we found that when there was a higher proportion of nurses working those really long shifts of over 13 hours, that patient satisfaction went down. And that was in things like whether or not patients would recommend the hospital to their family and friends, whether they would rate the hospital low on a scale of 1 to 10, and then also things like communication with their nurses. And then conversely, we found in hospitals that had a high proportion of nurses working the standard 8-hour shifts, patient satisfaction was improved.
So that's very interesting because obviously if making nurses work for very long hours brings down patient satisfaction, then the business implications for the hospital are clearly very negative. In spite of that, why does this situation exist? Did your research point out any reasons for that?
Well, we found that when we asked nurses questions about their scheduling and their shift length, that overall, actually, they were very satisfied with having flexible schedules, being actively involved in their scheduling. So that's something that we found was really interesting, that although most of the nurses worked these 12-hour shifts and they appeared satisfied with them, that there were still these negative implications for their well-being and then also for the patients.
Now, what are some of the business implications of not addressing these issues in hospitals?
Sure. So typically when nurses become burned out and dissatisfied, those are precursors to voluntary turnover. And so if they leave the hospital, the costs for recruiting, retraining, rehiring, and staffing temporary nurses is very costly. And it can be the annual salary of a nurse, which can be anywhere from $50,000 to $80,000 or so. So it's very costly for hospitals if they have a high number of turnover. And it's also, bad for staff morale, and it's not good for the patients either. So there's certainly a big cost associated with having overworked, dissatisfied, burned out nurses.
What implications do your findings have for on hospital reimbursements by Medicare and Medicaid?
Sure. So under the Affordable Care Act, there was a provision put in place so that hospitals now face reductions in their reimbursement if they don't achieve national standards on their patient satisfaction. And we use the Hospital Consumer Assessment of Healthcare Providers and Systems, better known as HCAHPS. And that was a survey that we used in our study. And if they don't achieve this benchmark, then they face reductions in reimbursement. So one easy way to help increase the likelihood of achieving those benchmarks is to have a well-rested, adequate nursing staff. And so by investing in nursing, hospitals have the potential to reap, more rewards through reimbursement.
Right. Now, based on your research, what changes would you recommend that hospitals make in the way in which nurses' jobs are structured?
So we were able to see that the nurses that worked the longest shifts, and we presume that they were overtime shifts, those were the most detrimental. So certainly curbing overtime, certainly completely reducing mandatory overtime, and then monitoring the rest of the nurses' work hours would be really important. And then also educating the nurses and the managers about the effects of working these long shifts so that they are aware that it can impact them, the staff as well as their patients.
What was the most surprising finding of your research project?
I think the most interesting piece that we found was what I mentioned earlier, was that most of the nurses really seemed on paper to be satisfied with these shifts, and they are actively involved in scheduling them. And so despite the fact that they seem satisfied with this scheduling, there's a disconnect because those nurses were also at highest risk for being burned out and dissatisfied. So we have to uncover a little bit more between what's going on there.
So maybe that's a topic for future research.
Certainly. Yep.
And one final question. Based on your research, what advice would you give high school students who may be considering going into nursing as a career?
I would definitely recommend it. It's a very rewarding career, and there's many, many opportunities as a nurse and many different places to work aside from just hospitals. I would caution nurses to make sure, though, that when they go out on their first job, that they ask about their scheduling and how much overtime is used on their unit, and just make sure that they take care of themselves so that they can take care of their patients.
Amy, thank you so much for speaking with Knowledge at Wharton.
Thank you.